The listening part of the occupational English test has three parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you hear two different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mr. Gwalather. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning. Good morning. Can you tell me about your problem? Doctor, I have had a skin lesion for the past 12 months. When I approached a local clinic, I was told that it is a skin tag. Do you have any pain? No, doctor. Any bleeding from the lesion or any trauma? No, doctor. I would like to evaluate and have a treatment for this. Okay, what's your age? 44, doctor. Do you drink or smoke? I'm a regular smoker, but drink very rarely. Where do you work? Actually, I do dynamite work, and in fact, putting in the dynamite in large holes for breaking ground for laying pipelines. I do frequent traveling for this work. Does anyone in your family have prostate cancer, kidney cancer, or any other illness? Nothing of such kind, doctor. Do you get fever? No, doctor. Are you positive for HIV, or do you have any STDs? No, doctor. Have you had any surgery in the past? Yes, doctor. I had back surgery with fusion of L5S1. What medications are you taking? I take Percocet occasionally for back discomfort. Are you allergic to any medicine? No, doctor. Well, your physical examination shows your blood pressure is 144/66, weight 177 pounds, your heartbeat rates and rhythm are regular. You have pedunculated lesion on the dorsum on your penis that is apparent. There is also another brown lesion mildly raised. Your testicles are bilateral and descended without masses. I think you have developed genital warts called molluscum contagiosum caused by human papillomavirus. The etiology is unknown, but it's most likely sexually transmitted. You have developed a viral infection that could have had a long incubation period. I suggest that from now on you have protected sexual intercourse to control the further transmission of the disease. Apply Condylox cream on the lesion for a period of 1 month. I suggest a CO2 laser therapy for the genital warts, which is just an outpatient procedure. However, there is a 20% chance of recurrence despite enucleating these lesions. Okay, doctor. I would like to go for a CO2 laser therapy. Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mrs. Gregorius. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Gregorius. Be seated. Tell me what your problem is.
Good morning, doctor. I'm having severe abdominal pain and nausea after eating.
What's your age?
38, doctor. I'm intolerant to fatty foods and my urine is dark colored.
Do you get fever?
Yes, I get chills and low-grade fever, nausea, and a sharp stabbing pain in my abdomen. But when I lie down on my right side, I feel somewhat relieved.
How long have you been suffering with these problems?
For the past 3 months, doctor.
Have you had any surgery before or any diseases?
No, doctor.
Are you taking any medications?
No, doctor.
Are you allergic to any medicine?
No.
Do you smoke or drink?
I do smoke 1 pack a day, but I never drink.
Do any of your family members have a history of any diseases?
No, doctor.
Tell me something about your family background.
I am married and living with my husband and 2 children.
Do you have any symptoms of seizures and ataxia?
Yes, doctor, I have.
Well, your MRI report is positive for cholelithiasis without CBD obstruction. Laboratory studies show that you have elevated bilirubin and elevated white blood cells. Your heart rate and rhythm is regular without any murmur or gallop. Bowel sounds are of a high pitch. Lower extremities are normal in color, touch, and temperature. No ischemic changes are noted. Range of motion is normal. You have developed gallbladder disease. I would suggest laparoscopic cholecystectomy with intraoperative cholangiogram.
Okay, doctor.
This is the end of Part A.